Thank you, Chair, and thank you so much to all of you for joining us today. I have two questions. My first one is for the Migrant Rights Centre of Ireland in relation to domestic violence. So I'm really concerned about your point that migrant women continue to experience barriers in exiting situations of domestic violence, accessing support services and retaining their immigration status. And I think most disturbing is that our immigration system actually facilitates domestic violence and coercions in that people's status are linked to their partners and there's no entitlement to retain an immigration status following your separation. You indicated that there have been some limited measures, but I'm wondering if you could explain the importance of proper reform in this area. And my second question is for the Amal Association in relation to maternity. And firstly, just to say, I think your research and proactive engagement on maternity care is to be commended. I'm aware of the barriers faced by different minority groups and disabled people, but your findings highlight the need for staff training and more kind of bespoke interventions. In particular, reference to the 4% of the participants when pregnant presented to the hospital for the very first time when they were in labour. Do you have suggestions for what measures need to be put in place to address that issue? And your research found that 15% of participants reported incidents of macroaggressions, mostly verbal abuse, with women reporting being shouted at, told to remove their headscarves, hostile attitudes towards their needs to remain as modest as possible. I'm just wondering if you could elaborate on that a bit as well. Thank you.
Thanks very much, Adele. Do you want to come in first?
My colleague Sancha is going to come in.
Okay, sorry, go ahead.
Okay, in terms of domestic violence, currently I'm attending right now a domestic violence issue, so it's so fresh. So the issue here is there is a policy in the Department of Justice, but this does not include, people who are undocumented. And the current policy is highly dependent on the spouse, on the person who is a kind of guarantor and depending on the immigration issues. So when people or women existing this domestic violence, they are afraid to lose their immigration status. So if you don't have immigration status, you don't have rights and entitlements, like even if you will access the women refuge, so you have a limited time. So there's no social welfare. There will be some issues on child benefit. They might stop it. So that's why they're afraid to exceed these particular issues, especially undocumented. So what we're asking for the government is to introduce or to include, probably it's time to renew the policy for domestic violence in the Department of Justice and to include also people who are undocumented, because if you're undocumented, there's nothing there for you. It's tough luck.
Thanks. Yara, are you coming in on the question from Amal?
Yes, I might come in, and if Noor wants to make any comments as well.
Yeah.
And I think it's just important to know actually the context in which our maternity research was conducted and commissioned for. So one of our migrant board member who was pregnant at the time was attending maternity-related medical appointments and noticed that, while Muslim women and women of minority backgrounds were attending the necessary pre- and post groups that are often offered by maternity hospitals, such as, breastfeeding groups or, baby massage classes or sessions and other means that are quite important, especially for new mothers. And so that sparked the interesting discussion amongst the board, and we thought to investigate further. And so, yeah, we have really kind of concerning findings. And, we found, what's necessary is mediation services and culturally appropriate services, which includes catering for dietary needs, language barriers, proper communication. Our research actually found as well that many women went without labour pain relief because of simply not understanding, or the challenges around language and the culture as well. So there's a lot I suppose to be said, and maybe Noor, if you want to come in on that as well.
Yeah, I was just about to say, I think about this issue because I'm having the experience the maternity services here in Ireland. And being a Muslim, we need to cover ourselves, and it's not just health, dietary issue. And another session that my colleague delivered a baby during COVID is very difficult for her because of the place that she. The room and the toilet are so far away, and every time she needs to go to the toilet, she have to leave her baby alone, and she have to cover herself. And then sometimes the toilet are, because of COVID, they need to be clean and stuff. So it's very especially for us, it's very difficult in especially during COVID. But I did think about it, but I don't know if it's too much to ask. But if there is any way, if, for instance, there is like a set of a session or a place where just Muslim woman is there, so that it will be. They are among women that is covering, so, and the toilet facility is near, so it's something like that. I know it's quite hard with all the things happening now, but that's one of the suggestions that I think will be great to have. Secondly, like Yara mentioned, I know the language barrier is very difficult. Sometimes they not themselves, but they don't really understand what the doctor or the midwife is saying. So maybe a training for the midwife and the doctors, just to make sure that the migrant or the woman that they cater really understand what they've been asked on that time. So because this is what the research say, that the woman doesn't understand, but just nodding because of she doesn't want to lose her face, but she asking her husband or the immediate family to what did she talk about? I don't really understand, that kind of thing. And one more thing that I want to mention, this research is not catered for some migrants, so we would appreciate if we can continue the research and to have more data on how to get more better service for not just Muslim, for all migrants in the future.